I run a small hostel in Barcelona, and last month watched an American woman break down crying at breakfast. She'd gotten food poisoning, spent 6 hours at the hospital getting 4 fluids and tests, and kept asking me when the bill would arrive. I handed her the receipt. €3 for the taxi. She stared at it like I'd given her a Monopoly card and said, "No, the hospital bill." I explained there wasn't one. She insisted the hospital must have charged thousands, that Spanish healthcare was just hiding the real cost. When I told her emergency care was covered under the public system, she pulled up her phone to Google whether Spain had some kind of payment trap where they bill you 6 months later. That's when it hit me how deeply medical bankruptcy has warped American thinking. She genuinely couldn't process the idea that healthcare could exist without financial ruin attached to it. My cousin in Dublin told me about an American tourist who twisted his ankle badly at Trinity College. Campus security called an ambulance, and the guy started screaming at them to cancel it. He was actually physically fighting the paramedics trying to help him. He was shouting about $20,000 and how he'd rather Uber to the hospital. They finally calmed him down enough to explain that ambulance rides don't cost anything here, that he wouldn't receive a bill. He didn't believe them. Even after they loaded him in, he kept asking the EMTs for pricing sheets and trying to negotiate payment plans. The EMTs were baffled. One of them told my cousin later they thought he was having some kind of mental episode because he seemed so terrified of help. At my gym in Copenhagen, there's an American couple who moved here last year. The wife started having chest pains during a workout class, and someone called emergency services. She refused treatment, started crying, saying they couldn't afford it, and begging people not to call an ambulance. The instructor had to physically stop her from leaving. Even after the paramedics arrived and explained 3 times that emergency care was free, she kept asking about payment structures and saying she needed to see the pricing first before they touched her. The paramedics documented it as anxiety-induced panic, but the truth was darker. She was so traumatized by American medical costs that she was literally choosing potential death over debt. I manage a community center in Oslo, and we hosted an American exchange student who kept asking bizarre questions about our public services. She wanted to know which hospitals were for rich people and which ones were for poor people. I explained that everyone uses the same hospitals, that wealth doesn't determine your care here. She insisted that couldn't work, that the system must have some way to separate people by income because otherwise how would good doctors make money? She'd drawn up this entire theory about how Norwegian doctors must have secret private practices on the side, where they do the real medicine for people who could pay. I took her to the hospital where I'd had surgery last year and showed her the waiting room with literally everyone mixed together. She studied people's clothing like she was trying to crack a code. My brother works at the tax office in Amsterdam, and an American expat came in demanding to opt out of healthcare contributions. He'd calculated that he was paying around €3,400 annually through his payroll deductions and wanted that money back since he didn't plan to use the medical system. Brother explained that's not how it works, that everyone contributes regardless of use. The American said that was communism, that in America, you only paid for what you consumed. He argued for 20 minutes about how it was theft to force him to pay for other people's health care. My brother finally pulled up the statistics, showing that the average American pays more than triple that amount just for insurance premiums before any care happens. The guy went quiet, then said, "But at least we have freedom." My brother still doesn't know what freedom he meant. I work at an international school in Brussels, and an American teacher asked how we handle fundraisers for students with cancer. I was confused, so I asked what she meant. She explained that back in Georgia, whenever a student got seriously ill, they'd do bake sales, car washes, GoFundMe campaigns to help the family pay medical bills. She wanted to know which committee organized that here. I told her we don't have those because families don't get medical bills for children's cancer treatment. She thought I was lying. She pulled up her phone and showed me GoFundMe pages for kids with leukemia, pages raising hundreds of thousands of dollars, and said, "See? This is normal. Someone has to pay for it." I explained that yes, someone does pay. It's called taxes. And it means 8-year-olds with cancer don't need to crowdfund their survival. She stared at me and said, "That can't be sustainable. I'm a tour guide in Vienna, And last summer, I had an American couple who kept asking about our charity hospitals. They wanted to know where poor people went for free care. I explained that all hospitals provide care regardless of income, that there's no such thing as charity hospitals here. The husband said, "Right, but where do homeless people go?" I said the same hospitals as everyone else. He didn't believe me. He insisted there must be separate facilities, that the system couldn't possibly treat a homeless person and a businessman the same way. I took them past the Allgemeins, Krankenhaus, and explained that everyone from students to politicians uses the same emergency rooms. The wife whispered to her husband, "The wait times must be insane," like she'd solved the mystery. When I mentioned I'd had an MRI last month and waited 9 days, she looked betrayed, like I'd lied about something fundamental. My sister is a pharmacist in Toronto, and she had an American customer absolutely lose it over a prescription price. He needed a month's supply of blood pressure medication, and the cost was 18 Canadian dollars. He started yelling that she was scamming him, that there was no way it was that cheap, that she must be giving him fake medicine. She showed him the official price list, explained that medication costs are regulated. He demanded to speak to a manager, insisted she show him the real bill. When she finally convinced him the price was legitimate, he broke down crying in the pharmacy, saying he'd been paying $340 a month in Arizona for the same thing. He couldn't understand why prices were so different. My sister tried to explain about bulk purchasing and price negotiations, but he just kept saying, "But we're America. We're supposed to be the best." I worked the front desk at a medical clinic in Sydney, and an American woman refused to leave after her appointment until I gave her a bill. Her consultation was bulk billed under Medicare, so there was no charge. She insisted I was hiding something, that doctors don't work for free. I explained 3 times that she didn't owe anything, that the government paid the doctor directly. She planted herself in a chair and said she wouldn't leave until I produced paperwork showing her debt. I finally printed out a receipt showing 0 balance, and she studied it like it was written in code. She asked if this meant she'd have worse credit, if not having medical debt would hurt her somehow. When I said medical debt doesn't exist here the way it does in America, she teared up and said, "You don't understand. I've been planning for bankruptcy my whole adult life. This doesn't make sense." My uncle manages a dental practice in Helsinki, and an American patient kept trying to negotiate prices before every procedure. She'd ask, "What if I only get 2 cavities filled instead of 3? Or can I skip the x-rays to save money?" He explained that her employer provided health coverage included dental, that she wasn't paying out of pocket. She didn't believe him. She'd argue that there must be hidden costs, co-pays, deductibles she hadn't seen yet. Before each appointment, she'd call to confirm the price, then show up with a written budget. After her 3rd visit, when no bill ever came, she asked my uncle if he was running some kind of long-term scam. He showed her the insurance statement proving everything was covered. She whispered, "This is what socialism looks like." But she said it with this weird mix of relief and grief. I'm a hospital administrator in Wellington, and we had an American tourist who needed an emergency appendectomy. Before surgery, even while in pain, he kept asking the surgeon for a cost estimate. The surgeon said to worry about it later, that right now they needed to operate. The American refused anesthesia until someone gave him a number. Our financial counselor had to come to the pre-op room and explain that as a tourist, he'd pay around 8,000 New Zealand dollars total, including surgery, hospital stay, and medications. He started laughing, then crying, saying his deductible alone in Texas was $12,000. He said, "I'm literally better off flying to New Zealand. It's getting surgery and flying back than using my insurance at home." After his surgery, he asked if he could just stay in New Zealand forever. He wasn't joking. I drive an ambulance in Stockholm, and we picked up an American woman having a severe allergic reaction. While struggling to breathe, she was gasping out questions about costs, trying to refuse transport. My partner kept assuring her there was no charge, but she wheezed, "How much?" between breaths. We finally had to tell her she was dying and we weren't discussing payment while she suffocated. At the hospital, even with oxygen support, her first question to the nurse was about billing. The nurse said something like €30 for NANEU visitors. And the woman started crying harder, saying that was less than her copay to see a doctor for a common cold back home. She said she'd avoided going to the doctor for 3 years because she couldn't afford it. The allergist treating her was horrified. She had a documented severe allergy that required monitoring. But the costs in America had made her just hope she'd never have a reaction. My daughter works at a pharmacy in Berlin, and an American student came in with a prescription for insulin. She was already crying when she handed it over, explaining that she was studying abroad for 6 months and needed to know the damage so she could call her parents. My daughter rang it up, about 35 euros for a month's supply. The student said, "No, for real." My daughter showed her the price on the computer. The student sat down on the floor right there in the pharmacy and sobbed. She said she was paying over $400 a month in Michigan, that she'd been skipping doses to make it last longer, that she'd nearly gone into diabetic shock twice. She asked my daughter if she could somehow stay in Germany, if there was a way to never go back. My daughter helped her contact a student visa advisor, and the girl ended up extending her study program, specifically to keep accessing affordable insulin. I'm a university administrator in Auckland, and we had an American professor who'd been here 5 years suddenly ask about going back to the US. His elderly mother needed surgery, and he was trying to figure out if he should quit his job to return and help her navigate bankruptcy. I was confused, so I asked what his mother's financial situation was. He explained she was middle class, owned her home, had savings, but this surgery would cost about $180,000 after insurance and would financially destroy her. He said he needed to be there to help her lose her house in a managed way. I didn't understand. So he walked me through how medical bankruptcy works in America, how families strategically shed assets before filing. He described it like it was a normal life skill, like teaching someone to ride a bike. I asked why she didn't just come to New Zealand for the surgery. He looked at me like I'd suggested she walk to the moon. I teach English in Reykjavik, and one of my American students missed 3 weeks of class. When she came back, she apologized and explained she'd been hospitalized for pneumonia. I asked if she was feeling better, and she said yes, but now she was trying to figure out how to pay for it. I reminded her that she had the public health insurance that comes with her student visa. She said, "Right, but that doesn't cover hospital stays." I explained that, yes, it absolutely does. That's the entire point. She pulled out her phone and showed me her Google searches. How much does pneumonia hospitalization cost in Iceland? And she'd found some blog estimating thousands of dollars. I called the hospital billing department while she sat there. They confirmed her total out-of-pocket cost was around 90 euros for the 3-day stay. She accused me of bribing them. She genuinely thought I'd paid the hospital to lie to her. I work at an immigration office in Lisbon. We process a lot of American healthcare refugees now. That's what they call themselves. They're people who moved to Europe specifically because they or a family member got sick. They couldn't afford American healthcare. Last month, I processed residency for a woman whose daughter has cystic fibrosis. She'd calculated that between insurance premiums, medications, and the eventual lung transplant her daughter would need, they were looking at bankruptcy or death. She sold everything they owned, packed 2 suitcases, and moved to Portugal, where her daughter's care costs them about 40 euros a month in copays. She said, "I'm not supposed to have to emigrate for my child to live." She was right. But that's what medical bankruptcy has done to America. It's created a healthcare system so broken that survival requires either wealth or exile. The saddest part is how many Americans still defend it, still insist that freedom means choosing between medicine and rent, still believe that bankruptcy is just the price of liberty.